Welcome back to It's Personal, brought to you by Gunderson Health System. I'm Chris Stauffer. Robotic surgery has been in the La Crosse area, believe it or not, since about 2007. Mainly, robotic surgery has been used for gynecological procedures, but that's changing. Here to talk about those changes is Dana Benden. Dr. Dana Benden, thanks for joining us.
You're welcome. Good to be here.
Well, thanks. Before we get into that, personally, you're a local person. Local doctor. You grew up in this area. Can you talk a little bit about your background, where you went to high school?
Sure. I went to Aquinas High School in La Crosse. I grew up here, and my mother likes to remind me that when I was 18, I said I was never going to come back. And I went to college in Madison, and then went to did my medical school in Madison. Went to Chicago, had my big city experience that I was looking for, and then realized that La Crosse has some great things for family and really great healthcare. And so it was really the healthcare opportunity, family that was here in the region that brought me back to La Crosse.
And now you see your kids going to Aquinas.
Exactly. They're following in the footsteps.
That's awesome. Well, thanks for practicing here in what used to be your backyard and is still your backyard. We certainly appreciate that. But let's talk about robotic surgery, around since 2007.
Yeah, so we had our first robot in 2007, started with gynecology and also urology. So we started doing some procedures and really have grown over the past 10, 11 years. We now are on our third generation robot. We actually have two robots currently. One is our second generation and one is our newer generation. And, we've done over 2,500 procedures as a system in La Crosse, and we are now expanding into the realm of general surgery.
Well, we want to talk about general surgery in just a second, but why did it start with gynecological procedures? Why that area?
So the initial FDA approval for the robot was within the urologic services for prostate cancer treatments, and then also in gynecologic procedures. And there was a lot of initial innovators in gynecology, in particular in gynecologic oncology, so taking care of women who have female cancers. And they were able to take a volume of patients that previously had to have open procedures and move them to minimally invasive surgeries with robotics. And that really was not able to be accomplished with just as good of cancer outcomes that had been accomplished open. So there were some initial moves to move into laparoscopy for certain procedures, but there was just kind of a plateau of the patients that were able to be treated with laparoscopic surgery for different procedures. And robotics really increased the volume of patients that would be candidates for minimally invasive surgery. And what we know with minimally invasive surgery is that patients do better. They get back to their normal life. They have fewer complications in relation to their surgery and postoperative course.
And why is that? Why is that? Less cutting open? What's the reason?
So it's two reasons. One is the incisions are smaller. So when you look at complications that can happen with open surgery, a lot of those complications are related to the large incision size and infection rates. And when you have smaller incisions, there's just less rate of infection. The other complication that we've seen decrease is the amount of blood loss that patients have, and that goes down when you do more small incisions. Probably part of it is in relation to the technology. So when we're doing laparoscopic or robotic surgery, our visualization of the patient internally is much clearer. You're magnified. You can see small little blood vessels and cauterize them before they bleed. And so you just wind up having less blood loss in general, less transfusions. And a lot of the way that we handle the organs translates to probably a little less inflammation in the belly, which can translate as less pain for the patient.
Well, one of the unique things that I know that you've talked about is that you're not necessarily standing over the patient now. You're actually, when you're doing a robotic procedure, you're off in a corner, almost looking like you're working on a video game of sorts. But the ability for you to see, as you have indicated to me anyway, small details really helps not only the patient, but you as a surgeon.
Absolutely. You know, I always tell patients and families when I'm talking to them, it's like if they have ever owned or when they first bought an HDMI or a high def TV, all of a sudden you're like, wow, the actors have pores in their skin. And the amount of technology and enhancement in the video that you see that is really like when the patient is open, but so magnified and so clear, it's really better than the distance from when I'm looking from my eye to where the surgical field is. That's all brought closer to me and more magnified and really a clear, crisp visualization.
And I wonder if this is something that a surgeon would want to admit or not, but the robot actually has greater field of movement.
It definitely does. So our wrists have limitations in the way that we can rotate them. And the robotic arms can obviously move in a greater degree of rotation than our wrists do. So whereas if we were doing a move, we might have to stop and reposition our hand to be able to continue the move, the robot really can continue that rotation without having to stop.
We're talking with Dr. Dana Benden, and it's about robotic surgery, which has been offered at Gunderson Health System since 2007. But really, the big news lately is that there's been a transition towards more general surgery. Talk about that.
So recently, probably over the last year and a half, as the general surgeons have seen the advancements in robotics and the procedures that can be accomplished in gynecology and urology, general surgeons have been looking at that technology to see how can it help them. And they have really started to grow their use of robotics, in particular for work with colorectal cancers and doing colorectal surgery and in hernia repairs, and even in gallbladder, liver resections, pancreas resections. So they have now realized the technology can afford them, again, increasing the amount of patients that can qualify for minimally invasive surgery that they might not have been able to offer. In particular, we have seen over the past year and a half, as our surgeons have started doing more colorectal work, that patients that would previously have had to stay for 7 to 10 days for postoperative recovery are now going home usually around day 2 after surgery, and their bowel function returns much more quickly. They have less pain and really are getting back to their normal life a little bit faster.
Well, there's obviously a cost savings there then for the patient.
Absolutely. I mean, if you think about it, both from a hospital stay, which is expensive, and from the impact to their life and being out of work, they are able to get back to their livelihood much faster when they are having incisions that are smaller and afford them a quicker recovery time.
Certainly good news for the patient, their family, and employers in the area as well. Talk, if you would, just a little bit about what patients say to you when you say, yeah, we're going to be using a robot on you for your procedure. What's the reaction?
So I try to explain it first from just, we used to do incisions that were from above your belly button down to your pubic bone, really big incision. But now we have technology that we can do small incisions, and we use some technology that uses a surgical robot. And sometimes I get wide eyes because the idea of what a robot is the robot doing my surgery? And no, the robot doesn't move unless the surgeon moves it. And we talk about the technology and how we as surgeons set up the surgical field, we connect the robot, and then once everything is connected, we have an assistant who will be at the bedside the entire time, and they help make adjustments on the arms as we need them or to assist us during surgery. And then we sit in the same room, but at a console just adjacent to them. So once they kind of get the visualization of how the room looks and that we're there and we are in control of the instruments, not the robot, usually they're much more reassured about that.
So where do you see robotic surgery in the future? Where is it headed? Because we're already seeing a transformation over a pretty short amount of time. Are we just having to wait for the government to get approval on furthering robotic surgery?
I think that we are likely going to see more and more surgeries that are converting from an open procedure to a minimally invasive procedure. There is really no doubt that evidence shows that patients do better with a more minimally invasive approach. So as we continue to study and see the outcomes of patients that have robotics and know that they are just as good as when patients have open surgery. Hopefully where robotics is headed is to be able to expand that patient population, to grow in procedures, and also to hopefully help with cost. And not just the cost of the actual procedure in the hospital, but the cost to society of having patients that have to recover longer and instead can get back to their normal lives and be functioning members of society a little bit faster.
Maybe when we think about this 20 years from now, we'll be thinking about this as a transformational time and how slow it actually got to be to get to furthering robotic surgery.
Well, and I think about it in the realm of when you look at how a computer started. A computer started and it took up an entire room, and now we hold a computer in our hand and use it as our cell phone. And I would foresee that robotics will continue to have that evolution where we might see it get more streamlined and just more a standard of how we function in day-to-day life.
Well, we're out of time, but I do want to ask you if you're a patient coming in, and should you be asking about robotic surgery? Because obviously there's a shorter recovery time. It seems to be better for both patient, family, and we even mentioned employer. Should that be something that you should talk to your doctor or provider about?
I definitely think you should. In particular, if you're going in for a procedure and your doctor is talking to you about doing an open procedure, I think it's something to bring up to your physician and say, am I a candidate for robotics? Am I a candidate for minimally invasive surgery? Because that, in the long run, is really what our goal is to get patients with fewer complications, quicker recovery time, and just back to their normal life a little bit faster.
Final question. This all started through Philanthropy back in 2007.
It did. We have had some very generous patients who have been very generous to our health system and really been able to provide the finances for us to have the technology. So we're very grateful to them. They have been the springboard for our program here at Gunderson Health System. I am grateful to them on a daily basis and will continue to be.
Patients and their families very grateful as well, that's for sure. Dr. Dana Benden, thanks for joining us. Again, if you'd like to learn more about robotic surgery, you can go to the Gunderson Health System website. That's easy to find. It's gundersonhealth.org.